Hi, I'm Ashley Mallari, and this is my presentation on the end-of-life care considerations for pediatrics. Generally speaking, more than 34,000 children die in the U.S. every year due to complex chronic conditions. In hospice care, 567 out of 100,000 children under 1 year and 51.5 out of 100,000 children between the ages of 1 to 19 years pass away. In infants, prematurity, congenital disorders, malformations and syndromes, and chromosomal disorders are often causes of death. Complex chronic conditions like cancer, cardiac diseases, and cystic fibrosis, in addition to congenital disorders, make up the leading causes of disease-related deaths in children. However, in older children, they are more likely to pass away from traumatic injuries such as car accidents and self-harm. Statistically, of all pediatric cancer patients, about 41% are in hospice care, where their life expectancy becomes very short and the goal is to provide comfort without curative treatments. And 14% of patients with prematurity are in palliative care, where the main concern is to prevent discomfort, pain, and symptoms, no matter what the diagnosis and life expectancy is. About 60% of those in hospice care are full code, meaning that all means of life-saving measures will be attempted if they are dying. On the other hand, pediatric hospice patients are 1.5 times as likely as adult hospice patients to be DNR or do not resuscitate. While culture cannot fully determine how an individual will think and behave, understanding cultural perspectives can help the healthcare team comprehend why families make certain decisions. As part of the healthcare team, nurses should actively listen with the primary goal of understanding and expressing the family's perspective. In many cases, one parent manages household responsibilities while the other stays with the sick child. The partner who is not included in the caregiving activities may feel neglected because all of the attention is directed toward the child, and the parent who is caring for the ill child may feel resentful to the other parent when they try to participate in care because they are not as experienced. Also consider the siblings. Are they responsible for any caregiving? Are they getting less attention from the parents? Encourage the parents to talk with the sibling about their perspective of their sick siblings and to be accepting of their feelings. Hospitals can feel foreign, so staying in one long-term can become very uncomfortable. Don't alienate your patients and family members by using a language they are not comfortable with. Enhance their experience and knowledge by using interpreters instead. Additionally, cultural norms are not the same for every family, especially in the diversity of the U.S. So be sure to make every effort possible to incorporate traditional cultural beliefs of a family into treatment plans. So ask questions and provide examples. Depending on the patient's diagnosis, quarantining might be required. This concerns family over the continuation of same quality care, who will be present and who will comfort the child, and how rituals will be carried out. Ensure consistency and trust when providing care to the patient. Additionally, be sure to provide support for families to cope. Be there for them to express any uncertainties and negative perceptions they may have. Assess their knowledge and gain their trust in order to provide emotional care to the family and provide any information that may clear up any misunderstandings. Don't forget to assess their availability. Does the family have enough financial stability to carry out their hospital stay? How far is the facility from their home? Do they have a means of transportation? Does the environment of the hospital feel like home for the child? If not, or if there's any challenges with any of those, they can be referred to social work to help. Physicians are not only responsible for the diagnosis and orders for the patient, but are also responsible for initiating end-of-life discussion and offering alternative comfort measures for families to choose from. Nurses need to ensure that the needs of the patient and family are met by carrying out orders as well as educating about the illness, establishing realistic goals, and providing emotional support. A child life specialist may be seen to provide emotional and developmental support for the child through play and therapeutic activities. They also participate in patient advocacy, family support, and education. A pharmacist would work to ensure that the patient will have medications that are appropriate for the need of the patient and that will not cause harm. Social workers help identify areas of stress and determine how to assist the family. They may refer the family to counseling services or help them find affordable daycare services or housing while the family copes with the loss of their child. A chaplain or spiritual advisor may be present to provide support, guidance, and comfort through the patient's family's faith and through holistic care. It is crucial to understand the different perspectives, competencies, and expertise each member may have. Although disagreements may arise, it is important to be respectful and remember that the center of focus is the patient. So ensure that efficient care is provided and be initiative. Ensure that coordination is possible. Be organized about communication and planning, distribute tasks with scopes of practice and workload in mind, and be sure to include the patient in their care so they can have some autonomy and control over their life. Ensure that there is equal participation in the plan of care and that commitments are made. Additionally, be aware of each other's knowledge. Don't assume that all is known. Instead, be clear and open to learning or teaching to increase understanding, efficacy, and efficiency of care. The goal of palliative and hospice care is to remove pain and suffering from the child while being sure to provide total care of the mind, body, and spirit. This means ensuring the patient is clean, comfortable, entertained, and emotionally supported to maximize the child's life. Administering medications is an important part of nursing care. Making sure the patient is hydrated through IV fluids, is receiving adequate nutrition from oral or tube feedings, and pain management from drugs such as ibuprofen or morphine is completed through routine schedules. Additionally, being aware of how to interact with a pediatric patient is important. Be sure to introduce yourself and to speak at eye level to not seem intimidating or scary. Be honest, respect emotions and privacy, and provide smiles to ensure that the patient's room stays as a safe space. Bring the child to another room if anything that may be traumatic has to occur, such as injections, procedures, and scans. And remember that not all children are raised the same. They may have different levels of knowledge, discipline, and mannerism. Work with the child and ask the family questions about how things are done at home to overcome any obstacles. When completing a procedure where the pediatric patient may move a lot, be aware of proper positioning. Placing the child on the parent's lap to hug or hold may be sufficient enough for procedures such as injections. Be sure that the child's head is turned away. Additionally, provide distractions such as toys, music, singing, TV, games, and deep breathing. Guided imagery can also be used to limit levels of discomfort. Prompt the child to imagine something that they find peaceful, happiness, and safety in. And be aware of language. Ask kids to describe their emotions and experiences instead of prompting them, and use gentle yet accurate words and simple vocabularies to express what will be happening. After death, allow the family to have some time to hold the body and give them the option for preparation such as bathing and dressing. Ensure that they have as much time as they need to say goodbye. Additionally, ask the parents if they have any post-death services in mind, such as burial or cremation. Ask if they have any death rituals or cultural traditions they would like to do and assist them in facilitating those traditions. Ideally, the healthcare team member that knows the family the best should address donations since it's a very hard topic to discuss. This is typically the nurse since the nurse is the one who provides most of the patient care while they were alive. Be sure to clear up any misunderstandings, such as how many and which organs may be donated, and how the removal of organs does not mutilate or cause any suffering to the body. And be considerate of religions. In Judaism, funerals are held as soon as possible after death. Autopsies, embalming, and open caskets are not allowed. In Muslim religion, burial takes place as soon as possible, and flowers and excessive mourning are discouraged. No embalming or cremation will take place, and autopsies are allowed for legal or medical reasons only. In Catholicism, a priest might be found at the bedside for death rituals such as reading of the last rites. And it's okay for organ donation and autopsies and cremation to occur. In Buddhism, family washes and prepares the body. Cremation is preferred, but if they're buried, the deceased should be dressed in regular daily clothes instead of fancy clothing. No organ donation is allowed. Grief and bereavement can take various stages and time, often reflecting the relationship the person had to the deceased. Children can grieve through play and behavior. One day they're really sad, the next it's as if no one died, and the cycle's repeated. Kids may need extra attention pertaining to their actions to identify anything out of the norm for a sad child. Ensure that all of the emotions are validated and that they are not rushed to feel like as if they are quote-unquote normal. It's also really difficult for people to reach out for help, so initiate it instead. Don't wait until the family needs help, but be there for them before anything dramatic happens. As mentioned earlier, social workers can help identify areas of stress in families. Maybe they're too emotionally drained and may need someone else to care for their children for a moment, so social work can arrange affordable daycare. Social workers can also refer the family to self-help groups and bereavement counseling to help express their emotions and feel understood. This is my reference list. Thank you so much for listening to my presentation.